Hello and welcome to all our viewers in Nigeria and around the world to Health Guide on Global Television, your hub for topical discussions on health matters. I am Queen Agaba. As the global population ages, more attention is being placed on how we can support older adults in leading active, healthy and fulfilling lives. Aging brings its own set of challenges, particularly when it comes to physical health and mobility. What are the effective ways to address these challenges and improve the quality of life for older adults? Joining me to discuss physiotherapy and aging and also enhancing quality of life for older adults is my guest on the program, Daniel Olubumi, who is a physiotherapist and also a general health practitioner. After this break, please stay with us. We'll be right back. Many thanks for staying with us. If you've just joined us, this is Health Guide on Global Television, your hub for topical discussions on health matters. I'm now connected to Daniel Olubumi, who is a physiotherapist and a general health practitioner. Hello, Daniel.
Hi, good afternoon. Good evening.
Hi, good afternoon. It's a pleasure to have you on the program.
Yeah, thank you very much. It's my pleasure.
Welcome. Pleasure is ours. And we've been talking physiotherapy now. I want you to talk to me like a layman what physiotherapy is in real sense. What is physiotherapy? Because when we say physiotherapy, what comes to mind is, pains or the bones, how to go about all of that. But what actually is physiotherapy?
Okay, all right. Thank you very much for the question. So basically, physiotherapy is it's the arts and science of movement. So it's we help as physiotherapists, we help people to move and function. Those are the key words: movement and function. So we help people to move and function, throughout their lifespan, from birth to death. And I believe everybody needs physiotherapy from childhood to old age. So basically, physiotherapy is just it's the art and science of movement. So any condition that affects movement, whether it's pain, whether it's swelling, whether it's anything that can affect an individual's movement and function. So physiotherapy is very important in the person's recovery. So physical therapy is basically the arts and science of movement, the science of movement and function.
And then we have physiotherapy, the act and science of movement. Now, how does physiotherapy contribute actually to enhancing the quality of life for older adults?
Okay, yeah, quality of life can actually be related. So basically, physical therapy like physiotherapy, it's very instrumental, very essential in the quality in improving the quality of life of the elderly. Like I said, aging normally is a natural part of life. So it often comes with its own unique challenges. As we grow older, from childhood to adulthood to old age, we experience that decline in mobility, strength, and our overall physical function. So physical therapy helps to maintain our quality of life. We have to stay active. It helps us to stay active throughout our normal day, throughout our activities of daily living, from our ability to stand from the bed, to roll on the bed, to stand from the bed, stand to walking, and to perform our everyday activities. You understand? So it helps us in the bid to help us to improve the quality of life. It helps us to to live our life to the fullest. We stay active every day. We tend to increase our life. We tend to enjoy our life. We tend to increase our years. So it helps us to build independence. Not able to being able to do your activity without support from any individual. So yes, physical therapy helps us to improve our quality of life, to stay active as much as possible. So, and it helps to improve our overall well-being, both mental health, both mentally, emotionally, and physically. Yeah, thank you.
Let me, because you're in that space, how much of awareness do we have about physiotherapy? Most cases, I hear people say there are a lot of surgeries that we have these days, the surgeries that people go into. If they know about physiotherapy and how effective physiotherapy is, there will be no need for surgery, as these things can be corrected rather than go through, surgical room. But how much of awareness do we have in this part of the country about physiotherapy and its impact?
Well, over the years, there has been very low awareness about physiotherapy in Nigeria because a lot of people believe, why do they need it? You understand? Some people believe it's too painful. Some people believe it's stressful, and so it is until when those people, when they come to the hospital, that's when they tend to know what physical therapy, what physiotherapy is all about. But now, like over the past few months, like a lot of like new graduates, a lot of physiotherapists have been trying to, to put their strength into making sure that the public are well aware about the impacts and the role of physiotherapy in the well-being, improving the quality of life of individuals, whether during the childhood, during the adulthood and the old age. So over like in the past few months, past few years, there's been a lot of awareness, even over the social media in communities, rural areas, in the urban cities, where people have gone on public awareness programs to educate people about the role of physiotherapy in in improving their quality of life. So, like in the past few days, in the past few months, I personally believe that it's currently increasing. And as a matter of fact, personally, I've also like tried to also like make some public awareness about my profession, even on national TVs and communities through secondary schools and all, to making sure that everybody is well aware about the role of physiotherapy, and it's actually very essential in improving the quality of life, to help us to also improve our physical life. And also, so I believe like in the past few months there's been an increased awareness about physiotherapy.
It's World Physiotherapy Day. I mean, last week Sunday,
Yeah.
September 8th, is marked as
Yes.
Physiotherapy Day, and we saw some form of awareness, although not in totality. And we really do hope that more awareness, would be given out as to what physiotherapy is and how important it is. But let's look at the most common age-related conditions, since our focus is on the elderly, that physiotherapists address in elderly patients. What are the most common age-related conditions for elderly people?
Okay, so the most common conditions for the elderly, it's sponged through musculoskeletal to neuro, and in layman's term, I think one of the most condition we have among the elderly is it's cardiovascular disease. Well, we can call it stroke. It's very common among the elderly. Then we have osteoarthritis, any form of arthritis, osteoarthritis, and we have post-op conditions. People like patients that have surgeries, maybe from fractures or from falls. The elderly tends to they have like an higher tendency to fall. Because of their because of their age, because of their age, so they tend to fall at falls tends to happen more during the elderly. So conditions proceeding from the fall. So patients that have surgeries, for example, total knee replacements, total hip replacements. So we have a lot of other conditions, osteoarthritis. I've mentioned that we have stroke, we have Parkinson disease, we have Alzheimer disease, we have dementia, we have so those are actually quite especially here in Nigeria, those are the common conditions we have in the elderly. And it's, for example, stroke is quite like more common here in Nigeria, and it can be attributed to some factors, especially when there is a family history of stroke, a previous history of stroke in the individual's family, then physical inactivity of such individual, then obesity, alcohol consumption over the years, which has actually accumulated. Then we have so that's basically like the most common conditions we have.
And physiotherapy helps enhance these issues. How about exercises, everyday exercises that older adults can can engage in to maintain their strength and flexibility?
Yes, yes. So as physiotherapists, we are exercise specialists. We are movement specialists. We prescribe exercises. That's what actually makes us different from the doctor, or no, from the traditional practitioner. We prescribe exercise from the gym instructor. Do you understand? We prescribe. We don't just tell patients to just go and do any kind of exercise. Yeah, exercise is specific. It is individualized. It's a We prescribe specific individualized plan for the patients that is very safe, and that's very safe for the patient, which is very much important. For example, to patient that has stroke, we can't prescribe the same exercise, um, the same intensity of exercise for both patients. So we need to like rule out all the red flags on the underlying conditions before we can actually, okay, yes, this exercise is safe for these patients. So as physiotherapists, we prescribe exercise that is very safe for the patient. So exercise helps to relieve pain, to improve our mobility, to even prevent fall, to improve our balance, coordination, and also helps to improve the quality of life. To improve strength in the individual's joints and body system. So yes, exercise is very important. We prescribe exercises, and that is actually like a major modality that we use for that we apply for our patients.
Interesting. Daniel, let me ask you, what's the
All right.
difference between a physiotherapist, what you do, because most people when you hear people who have issues of joint pain or movement
Yeah.
issues, they would rather go to a traditional therapist. What is it that a physiotherapist does that is different? Because we see people go the local way, they have their bones stretched, they have, they do all forms of exercises as well. So how different is physiotherapy from these other exercises?
Well, the difference between us and the traditional practitioner is basically um, was in our mode of treatment. We prescribe evidence-based practice. It's the evidence has been proven to work in the number of patients. So we don't just give anything because someone is having some pain. Do you understand? We have to examine the patient, assess and diagnose the patient. Going through that pattern of assessment, then coming down with a diagnosis. Then perhaps if there is any red flag, we can refer to a doctor, we can refer to the surgeon, we can refer to any member of the rehabilitation team. Do you understand? But the traditional practitioner, they don't have like a structured assessment. They believe that anybody that comes with pain or anybody that comes with fracture, they do their normal thing, and that's why most of them eventually come down to the hospital for treatment. Most of the patient that comes from traditional doctor, they eventually, like most of the backlog of them eventually comes to the hospital, and that's to say that a lot of people will actually do some ridiculous things to making sure that the pain go up. Do you understand? So pain can be relative. A lot of people they feel pain every day, and they will do anything possible to make sure that they are relieved. So that's why, and then there's some certain challenges that we have in the Nigeria healthcare system, why people actually prefer to go to the traditional traditional practitioner than to come to the hospital. Do you understand? So we have a lot of challenges in the Nigerian healthcare system. But as a physiotherapist, we have a structured plan. We have a structured assessment plan for the patient. So we prescribe what is safe for the patient, and if possible, if after reading out all the red flags that is not amenable to physiotherapy, we can refer to a surgeon, we can refer to any member of the rehabilitation team, to a psychologist, to a doctor, to a musculoskeletal, to an orthopedic surgeon, or any member of the rehabilitation team. So that we prescribe evidence-based, which has been proven to work
over
so
time. Yeah. Absolutely. Daniel, this is such an interesting topic that I would love for us to continue. But this is where we would have to, my producer is already signaling to me, and I hope that we get to, continue, because there are a whole lot of questions that I'm sure that our viewers would want to know about physiotherapy, particularly with what you have just said, as and and all that. But we'll draw the curtains here, and I do hope that you grant us that opportunity to have this conversation with you again.
Yes, definitely.
All right, thank you so much. This is where we draw the curtains on Health Guide today. If you've just joined us, we have been speaking with Daniel Olubumi, who is a physiotherapist and also the co-founder of Health Better Limited. We would like for you to follow us across all social media platforms using @GlobalTVNG and other handles now showing on your screen. I'm Queen Agaba. Thank you for watching, and see you again.